Everyone, once again welcome to my Oet channel. So today we will see another one role play card. This is in clinic and your 20-year-old patient is going to be traveling around Africa to do work experience for 3 months in a few months time. He or she has read about taking anti-malarial tablets but does not want to take them, so see you to check if they are really necessary. So in this scenario you are just giving some explanation regarding anti-malarial tablets, and this person is going to work in Africa for few months and he will travel after few months also. So we will see the task. The first task is find out reason for patient's visit. And this is happening in clinic. It's mostly community clinic, local clinic or something like that. So you don't know the patients. You can just start like greetings and self-introduction. Good morning. Then get back the greeting. My name is Rashmi Rajan. I am one of the registered nurses working in this clinic. How may I address you and how can you help? How can I help you today? Then the answer will be, good morning sister, my name is Matthews and actually I want to get some information regarding anti-malarial tablets. Then the next task is find out relevant patient details, any medication, medical conditions, and explore patient's reluctance towards anti-malarial tablet, previous problems, side effects, length of time needed, etc. So we have more questions here. So we can start like this. Glad to see you, Mr. Matthews. I am here to help you. And before proceeding further, may I ask you some questions? Then, after getting the permission, we can ask, could you please tell me, so why you want to know about what is the reason behind of your anti-malarial tablets information? So whether you will travel anywhere, then the answer will be, yes, sister. Actually, I'm planning to travel Africa to do some work experience for 3 months, and I will leave from here in a few months. But actually, I have seen in my contract paper that we have to get anti-malarial tablets because this Africa is very relevant to get this condition. I mean the malaria, but really I don't want to take this medication. So that's why I just want to know whether is it mandatory to take medication before going there. Then we can tell that, okay, thank you for your information, and really I will need to ask some more questions. Do you have any disease conditions, or are you on any long-term medications? Then the answer will be, no sister, I am pretty good, I have good health, I don't have any condition, and I'm not on any medications. Then we can tell, glad to know that, Mr. Matthews. And may I know, so what is the exact reason behind of your reluctance towards antimalarial tablet? Did you experience any previous problem or side effects or something like that? Then the answer will be, actually from my contract I could see the information regarding antimalarial tablets, and I could see that it is like long term I have to take. Really I am thinking about the side effects and the length of the time which I need to take the medication. Then the answer will be, the task, actually the next task is emphasize range of antimalarial tablets available, variation in duration, side effects, advice given for patient selection. Then the next task is one of limited effectiveness of other method. So we will just finish this task. That means we have to explain. Okay, I can truly understand your concern, Mr. Matthews. No need to worry. I can explain you with that. Actually, we have different types of antimalarial tablets. It's according to the duration and according to the lesson side effects. So there are for 1 month duration, for 2 months duration, and for 3 months, and even it's for 15 days. According to the duration and the side effects, you can choose the type of tablets. So I can provide you a pamphlet in that the detail about antimalarial tablets are given, so it will be useful for you to select. How does that sound? We can ask like that. That answer will be, yes, it sounds good. And actually I have another one more idea. So I'm planning that if I travel Africa, so the problem is with the mosquito, right? So I'm feeling that, I'm thinking that I can apply this mosquito repellent creams, or in the night time I can use a net, mosquito net, something like that. So, and long sleeves dress. So is it okay to protect myself with these measures? Then We can warn. The next task is warn of limited effectiveness of other method. No guarantee of complete protection. Best used with the medication. Give information about malaria. It is a severe and recurrent condition. Risk of serious complications. Find out details about patient's work experience, departure date, type of work, rural or urban location, etc. So what we can do, it is a warn. You could not tell that you should not do like that. You have to do like this. So how we can warn? You can tell that yes, Mr. Matthews, I can really understand your concern and worries, but really very sorry to tell you that these type of measures are sometimes ineffective to protect yourself from malaria mosquitoes because there is no guarantee of complete protection. But if you take this medication, I can give you 100% surety or reassurance that you will be get protection from mosquitoes. And if you are willing, I can explain you regarding the malaria. May I proceed with that? Then after getting the permission, we can tell that actually this malaria is a condition I can tell you that it is a severe or recurrent condition, and the complications are very serious if it's get. So it is always better to have protection when you travel in these countries. So always we used to give advice to for all person those who will travel in this type of countries to get protection from malaria. Are you getting my point? Then we can tell that I before proceeding further, if you are willing to take the anti-malarial tablets, I can get some. If I get some further information, it will be easy for me to guide you regarding the medication usage. Is it okay for you? Then the patient is telling that, okay, sister, I can understand what you are telling. Of course, I can take the anti-malarial tablet because there is no other choice. Okay, you can go ahead with your questions. Then we can tell that, okay, Mr. Matthews, thank you for your acceptance. And would you mind telling what type of work you will do there and when you will depart, when is your departure date, when you will leave from here, and what is the type of work you will do exactly, whether you will be in rural or urban location? So the answer will be actually I'm going for my work experience. I will be in a field work as well as in office. So mostly I will be in urban location, but rarely I need to go to rural area also, and I will leave from here within 2 months. Then the next recommendation, the next task is recommend antimalarial tablets, reduction of risk of malaria approximately 90%, advice need for further appointment 8 to 12 weeks before departure, checking vaccination history, vaccinations, further guidance on antimalarial tablet. So we can present like this. Well, Mr. Matthews, so I would like to recommend you these antimalarial tablets. You can choose from this pamphlet and you can inform me. I will consult with your general practitioner, and I can reassure you that you will get 90% of protection from the malaria. And in addition to that medication, you can use other mosquito bite precautions also, as you mentioned earlier. And I would like to advise you to come for the further appointment within 8 to 12 weeks before departure. It is to check your vaccination history and your all further vaccinations which is needed before traveling. And of course, the GP will give you further guidance on antimalarial tablets, its side effects, and so on. Everything you will get complete information regarding this antimicrobial tablets usage. So how does that sound? Or you can ask, is it okay for you? Am I clear to you? So whatever you can ask. Then the patient's answer will be, of course, sister, thank you for information. Of course, I will come back to you before 8 weeks of travel. Then we can ask, Mr. Matthews, I hope I have clarified all your doubts. Do you have anything to be clarified? No, sister, I don't have any more clarifications. Thank you for information. We can tell that. Okay, Mr. Matthews, thank you for your visit. And meanwhile, if you need any clarification, please do not hesitate to contact with us. This is our contact number. Have a great day. So with that, we can conclude. So this is the conversation, and here actually this is information giving only. So you will get some information, you will give some information. So of course you have to include or involve a patient as much as possible, because in this type of role play it is much effective if you include patients, because patients have more concern about this tablet. I hope it is clear for you. We will see you with another informative video. Until then, bye. Take care.